Welcome, everyone. Before we begin, just to remind you of some housekeeping rules. I think one of the most important ones right now, because I hear some background noise by someone who has not muted themselves. Please make sure to turn your microphone off until later on when we have the chance to go into smaller groups. Please make sure to introduce yourself in the chat, where you're from, which organization you represent today, so that you can get to know each other a tiny bit on the side. Just to remind you that this event will be recorded. So if you want to make sure you are not filmed, please turn your camera off. The slides will be shared afterwards. So unlike other events, there's no need to take screenshots due to our tight schedule today. We unfortunately don't have time for specific Q&As after the presentations, but if you put questions in the chat, and please do so, we will provide a summary of the issues raised in the write-up of the meeting report. And now we are officially getting started after being done with our housekeeping. Welcome to this event, the first inaugural event of the Global Initiative on Loneliness and Connection, GILC for short. My name is Janis Kullenkort and I'm tuning in from Germany, as well as being the representative of the Togetherness Hub, the International Forum for Social Health and Loneliness Professionals. I'm also a proud member of GILC, which has worked with the Campaign to End Loneliness to organize this event today. So this is why it's especially exciting for me to chair this event today. Loneliness is a global issue. The restrictions on social contact across the world during the COVID-19 pandemic led to widespread concern about loneliness. The pandemic also highlighted the importance of social connections and relationships for our well-being and ability to cope in these challenging times. Today's event, so going through the agenda, today's event will look firstly at the picture of loneliness across the world, thanks to Dr. Mareike Ernst from the University Medical Center Mainz, equally here in Germany, being part of a joint research operation with the WHO. We then look at research from a specific country, in this case, the United Kingdom and the Campaign to End Loneliness. Robin Hewings from the campaign will present the biggest ever review of the impact of COVID-19 on UK loneliness so far. And then we look more in depth on how an individual country has met the challenge of tackling loneliness in practice. We're especially delighted to welcome Dr. Ruth Berhay on the experience of Zimbabwe and the role of the Friendship Bench organization. The journey then still continues, and we will take a look at the global political perspective on loneliness and the worldview from senior politicians such as Fiona Martin, Member of Parliament for Australia, and have the chance to see and hear a discussion where Fiona Martin unfortunately couldn't be part of, chaired by Dr. Vivek Murthy, 21st Surgeon General of the United States, and will also involve the Minister for Loneliness in the United Kingdom, Baroness Barron, alongside Australian Member of Parliament, Andrew Giles. We will then hear directly from the Global Initiative on Loneliness and Connection, the co-directors of GILC and my dear colleagues, Adi Garcia and Dr. Michelle Lin, who will present the overview of GILC and its role in responding to this unique set of challenges that face us. I hope you are still with me, because last but not least, we have the opportunity to hear the outline of what the global response should be to loneliness from Dr. Naoko Yamamoto, Assistant Director General for Universal Health Coverage and Healthier Populations at the World Health Organization. You are not mistaken. We squeezed a lot in today's webinar. We promise it will be worth every minute. So to begin with, we have an opportunity to review world research on loneliness, and we're so delighted to have Dr. Mareike Ernst with us today. Dr. Mareike Ernst is a postdoctoral researcher and psychotherapist in training at the Department of Psychosomatic Medicine and Psychotherapy of the University Medical Center Mainz, Germany. And Dr. Ernst will be presenting her work for the World Health Organization on the systemic review on the prevalence of social isolation and loneliness pre and post-outbreak from around the world. Dr. Ernst, the stage is yours.
Yeah, thank you so much for the kind introduction. I'm very honored to present our findings in this context. I'm just trying to share my screen and I hope that you can see it now. Okay, so as you heard in the introduction, loneliness was already an important topic for public mental health before the COVID-19 pandemic, but there was great concern that measures such as lockdowns and restrictions on social gatherings might aggravate loneliness in the community even more. However, when we looked at the first findings which were published, they appeared to be mixed. So we set out to summarize high quality original research and also to investigate potential predictors of changes in loneliness, comparing pre-pandemic and during pandemic assessments. So this means our team, and I especially want to thank Chris Micton from the WHO who brought this group together. There is no time to present all details of the method, of course, but they were registered in Prospero before we conducted the search. And for now, I just want to mention two main criteria studies had to fulfill to be included in our review. So first, they had to be about reports from actual participants concerning their subjective feelings of loneliness, instead of, for example, number of social contacts they had over the day. And second, we only included studies with at least two measurement points, one point being before the outbreak of the pandemic, and the second point after the outbreak of the pandemic. And these could be truly longitudinal, meaning the same people were assessed at both times, or they could be pseudo-longitudinal, meaning, for instance, two population representative surveys conducted in different years with different participants, but using the same measures to be able to compare them. We then identified 6,850 records, and after the removal of duplicates and studies that were not eligible, we arrived at 32 studies. And most of them had in fact assessed the same participants multiple times, and many studies had drawn their participants from the general population, sometimes with a special focus on older or younger generations. In total, the original research comprised more than 185,000 participants. Okay, I'll now present the main results concerning the main research question you're all interested in, is whether there was an overall increase in loneliness. So first, what you see here is the aggregation of studies reporting continuous scores, meaning, for instance, the sum score of the UCLA 3-item loneliness scale, which was used pretty often. And of those, we had 24 original studies, and the summary shows there are overall higher values during the pandemic compared to before the pandemic. So for a quick...
Dr. Ernst, you accidentally muted yourself, I guess.
I'm sorry. So I hope you got that the main takeaway from this slide was that when you pool the effects, we see higher values during the pandemic compared to before the pandemic. Okay, and here is the same slide for the studies reporting prevalence rates instead of continuous scores. And here we have basically the same results. So we see higher prevalence rates of loneliness during the pandemic compared to before the pandemic. And the second point we were interested in were the predictors of changes in loneliness. And to this aim, we modeled a meta-regression. And the only statistically significant predictor in this regression model was the duration of restrictions, meaning how long the restrictions had been in place at the assessment which was conducted during the pandemic. And this effect was positive in the sense that longer restrictions were related to greater increases in loneliness. I would like to end with some key strengths and limitations of this work. So while most original studies had a risk of bias in one or multiple domains, taken together, we found no evidence of publication bias. So the findings can be considered to be robust. And a limitation is that most studies came from Central and Western Europe and the US and Canada, which means that other parts of the world were underrepresented in our review. And just to finish, we think that the findings, one, that we saw overall increases in loneliness, and two, that they were driven by the duration of restrictions, highlight that loneliness must become even more of a public health priority as the pandemic progresses. Thank you very much.
Dr. Ernst, thank you very much for this international perspective and your insightful findings. Once again, unfortunately, due to our tight schedule, we can't answer questions right now, but please make sure to share your thoughts, your questions in the chat, and we will make sure to consider them for the write-up and also to forward them to the speakers after today's event. Moving on. Having seen the research underpinning the experience of loneliness across the world, we now want to look towards Robin Hewings, Program Director from the UK's Campaign to End Loneliness, who will present their research on the UK experience of loneliness during COVID-19. Robin, is your microphone.
Lovely. Thank you very much, Yanis. I will just start the process of sharing my slides. So yes, I just want to acknowledge our funders, particularly National Lottery and the North Sea region. So yes, we are launching this report today. We've looked at a number of different sources of data to try to understand what's happened to loneliness during this period, and also what we can expect for and hope for in the future. And I suppose the top level finding is that while there were these laws that applied to everyone, how they were experienced by people really varied. And what we found using both data from the Office for National Statistics, some other research studies, but also having a really long-lasting and deep set of engagements with people who are working in different ways on loneliness. We found that there was a really big increase in demand for support for issues to do with loneliness and social isolation. And there are a few different reasons for that. We see in the statistics from the ONS that there was quite a big increase in the kind of broader definitions of loneliness. People saying that loneliness was affecting their well-being, people saying that they were sometimes or often lonely. But what we also found was that there was an increase of about 1 million people in the number of people who were saying that they were chronically lonely. So the kind of category of loneliness that we worry most about. And finally, we think another reason for that increase in loneliness actually was that services joined together, people were much more willing to talk about this issue, people reached out a great deal more, and as a result, we think we've found a great deal more people who can be helped than ever before. So in terms of who that is, the key thing really was we found that the existing risk factors for loneliness carried over from pre-COVID into COVID, and that related to people who were more likely to be deprived, who were in worse health, or who had disabilities. And finally, it was particularly related to younger people. Being younger was always a bit of a risk factor for loneliness, but that's really stepped up in this last period. So in terms of what we can do, we think we need to focus services on people who are experiencing chronic loneliness, particularly because we're concerned that for at least some of the people who have become chronically lonely, life won't just snap back to normal, because being chronically lonely makes it harder to reach out, and there is a real risk that some people may get stuck. We think that reflecting what we know about the risk factors for loneliness and how they've been compounded in this period, we need to target the most disadvantaged communities. where loneliness is a particular risk, and also that generally has the lowest amount of social support in place. And finally, there are massive changes happening to how we commute, how we shop, and there have been big effects on the hospitality sectors as well. And we think it's important that while all of this change is happening, we try to make sure that our communities and our neighbourhoods have really strong places for people to connect, to bump into each other and form the friendships that mean so much to us. That's a whistle-stop tour, quite a rich and deep report. You can read more on our website, and I hope you find that useful. Thank you.
Thank you, Robin. It's always a pleasure to see the high frequency in which the campaign provides high qualitative updates, reports, and new evidence around loneliness. I think it's safe to say you're definitely ahead of the curve internationally. We now look more beyond the research findings. We are pleased to dive into the practical experience of Dr. Verhey, one of the co-developers of the Friendship Bench Zimbabwe, a project which was set up more than 20 years ago and is an evidence-based intervention developed in Zimbabwe to bridge the mental health treatment gap. Dr. Verhey, welcome.
Hi, thank you so much for the invitation, and hello everybody, and thank you for joining this really important webinar. I will also try to pull up my screen now to go into my quick presentation. Okay, where are we? Here we go. Okay, so I'm just going to tell you quickly about the Friendship Bench and how we address loneliness, which, though, I must say, we haven't studied in depth yet. We're just about, after I heard Dr. Ernst speaking about it, we're just about to validate the loneliness scale as well to use it and deliver some data soon. As you can imagine, we in Zimbabwe, a lot of people live very closely together, and I think we all know that there's a difference between loneliness and being alone. So we can be with a lot of people and still feel very lonely. So, okay, here we go. Just to give you a big highlight, this is one of our typical counselors on the Friendship Bench. We often call them grandmothers because somehow by default they happen to be elderly women who are employed by city health authorities in 3 cities that we majorly operate in. And they have grown old on their jobs. So we did not particularly look for elderly women, but these women are highly regarded in their communities. They have the knowledge of the communities. They also have been staying in the communities, and they are therefore perfectly placed in this role. So somehow my thing's not working here. Oh dear. Somehow I can't share. Just go to the next slide. I don't know what I'm doing. Oh yeah, here we go. So the Friendship Bench is a psychological intervention. We offer problem-solving therapy and combine that with a support group, like voluntary support groups that are majorly focusing on income generation. As you can imagine, people are affected by transgenerational poverty, a lot of gender-based violence, chronic diseases. I'm just mentioning the HIV pandemic that's also been with us for many, many years. And therefore people are having a lot to deal with and relatively little possibilities to share or to change their circumstances. We're trying to bring people together and create a safe space for sharing, which is taken up. We have trained 700 lay counselors in them. We often call them community health workers or volunteers, really. And we have seen 60,000 people in the past. We're trying to really create awareness around mental health to reduce stigma. In our setting, there's a lot of misunderstandings around mental health. And I think actually that's all over the world, so everybody can benefit from more knowledge. Same story. Oh God, I'm sorry. Somehow. We go. As I said, we work with community health workers, and I can never go past this and highlight how important these particular people are. In many low and also middle income countries, community health workers are being used basically for specific work. So that's called task sharing or task shifting. And in mental health, there's some studies out that showed how successful this approach is. And I always find it important to highlight that these people are not just lay health workers or community health workers. They become experts over time. And they, besides their actual work duty, they are essential for the community in itself, as they often live in the communities they work in. They are easily approachable and therefore agents of change, but they are underestimated and undervalued. And their experience and just life and work experience often not reflected in how they're being remunerated for their work, for instance. So just on the sideline. Why do we need community-based mental health? Because this is really what the Friendship Bench tries to do. We are in several African countries right now. And at the moment, I'm also talking to people all over the world to get the Friendship Bench in other countries, also high-income countries. We want to create a better access to care. We all know how difficult it is to get psychological support. And we don't want to wait for people to be fully ill, of course, right? So we are working with what we call common mental disorders, which you could probably roughly translate to depression and anxiety, maybe subclinical as well on that level. We want to integrate this sense of belonging for people, which is exactly where the loneliness starts. If we don't feel we belong, we will feel more lonely. Like I said already, stigma reduction is an extremely important point. We know, for instance, that there's a gender difference in seeking help that needs to be tackled, because as we all know, loneliness does not stop at borders or genders or poverty or rich levels or whatever. In our setting, it is extremely important, and the WHO also works on that at the moment, that mental health care is actually integrated in all programs. And again, for sub-Saharan Africa, HIV programs are very important there. Okay, so with the COVID restrictions, we had to super quickly rethink. So we actually, as you saw, work on benches within primary healthcare clinic premises. And when the clinics closed or had very reduced access only, we thought, okay, can we do this online? So here you can see how our delivering agents are also trained online, which was quite interesting. So the only kind of way of communicating in Zimbabwe that is halfway affordable is through WhatsApp. So we're exploring how to do all these things. So Zoom is not possible. A lot of people don't have access to, most people don't have access to Wi-Fi. So WhatsApp was actually, yeah, is a base to work from. We're exploring, and it's quite interesting. We also now offer counseling over the phone, texting, voice messaging through WhatsApp. You can find more information on our website. Good, that's all. Thank you so much.
Dear Dr. Verhey, it's really impressive what you've set in motion, how the Friendship Bench program truly changes the dynamics within the community by empowering the community itself.
Okay.
We unfortunately need to move on without questions. Having heard from the UK and Zimbabwe about the experience of loneliness during a pandemic, we now move to hearing from some of our global political leaders on their perspective, both in leading their country's response to loneliness, but also their view on what the global response should be as the world recovers. Firstly, while she was unable to join us for our panel discussion, we have the opportunity to hear from Dr. Fiona Martin, Member of Parliament from Australia and Chair of Select Committee on Mental Health and Suicide Prevention, on Australia's experience of loneliness, followed by a panel discussion of global leaders chaired by Dr. Vivek Murthy, US Surgeon General. Dr. Vivek Murthy is the 21st Surgeon General of the United States. Actually, he was also the 19th Surgeon General, and he's also the author of Together, the Healing Power of Human Connection in a Sometimes Lonely World, a renowned book which explores connection and loneliness. Baroness Barron is the Minister for Civil Society at the Department for Digital, Culture, Media and Sport in the UK. As part of this role, she oversees the government's work to tackle loneliness as the Minister for Loneliness. And last but not least, as an Australian Member of Parliament, Mr. Andrew Giles is currently the Shadow Minister for Cities and Urban Infrastructure, Shadow Minister for Multicultural Affairs, and Shadow Minister assisting for Immigration and Citizenship. A particular interest of Andrew's is how governments can respond to deal with loneliness as a public health challenge. So in 2021, Andrew launched the Parliamentarian Friends of Ending Loneliness and is co-chair of the group. I'm really excited for this video contribution and hope you all enjoy it.
Hi, I'm Dr. Fiona Martin, the Federal Member for Reid and the Chair of the Mental Health and Suicide Prevention Committee. I'm also the co-convener of the Parliamentary Friendship Group for Ending Loneliness with my colleague Andrew Giles. I'm really sorry I can't be with you here today at the launch of the Global Initiative on Loneliness. Loneliness is one of the biggest public health issues for the 21st century. And it's certainly an issue that really needs to be addressed in my country, in Australia. Loneliness predicts poor mental health and well-being, and it is associated with higher suicidality. Helping bring people together and to connect people in meaningful ways is an important priority, not just for our government, but for governments around the world. I'd like to congratulate all the world leaders who are at this important global initiative today and wish you the best of luck. Thank you.
Well, hello everyone. This is Vivek Murthy. I want to first thank Fiona Martin for her wonderful presentation just now. I'm sorry she couldn't join us on the panel, but we are grateful to hear from her. And I'm grateful today also to be joined on this panel by Baroness Barron and Mr. Andrew Giles. I want to thank both of you, Andrew, Diana, for joining me today as we're going to discuss loneliness and social connection. When I first began my first tenure as Surgeon General in 2014 in the United States, I didn't expect that loneliness and social isolation would be on my radar, that they would even be priorities. But what happened to me is I was really educated and informed by people all across the United States, and then later by people around the world, including Australians and people from the UK and other parts of the world who helped me recognize just how profound an issue this was all across our globe. But in my own life, I had seen loneliness up front. I had struggled with loneliness as a child, certainly in elementary school, and then at various points during adulthood, including, it turns out, during my tenure as Surgeon General the first time. And as a doctor, I had seen loneliness up front as well in my patients. Not again something that I was expecting or that I was trained to make sense of or much less address as a doctor, but one that I saw nevertheless, as patient after patient, it would often come in alone. And at really difficult moments, we had to make a tough diagnosis or where we had to some bad news to a patient, I would sometimes ask them, is there somebody you want me to call so that we can have them join for this conversation? And far too often the answer was, I wish there was, but there's no one to call. And so hearing that again and again, loneliness was familiar. But what I learned when I joined government in 2014 and spoke to people all across our country here in the US was that those experiences were not unique to me or to the patients I was caring for, but they were very, very common. And people would often say to me, not I'm lonely, but they would say, I feel I have to deal with all these struggles that I'm contending with in my life all by myself. Or I feel if I disappeared tomorrow, no one would even notice. Or I feel invisible. And that last word, invisible, often stuck with me because I realized how many people walk around feeling like they are not seen, that they are not understood, like they don't matter. And in those feelings, I think, is captured so much, I think, of what loneliness can feel like and how it can impact so many around us. And so with that said, I'm really grateful to have this chance to talk with Andrew and with Diana about the loneliness, because this is a profound challenge, one that also has profound health consequences, something I also came to learn in terms of consequences not only for our mental health, but for our physical health as well. And so addressing loneliness is not only something that we have to do for our health, but it's something that we have to do to better understand the condition, the human condition of millions and millions and millions of people all across the world, including often many of our family and friends who are struggling in silence due to the unfortunate stigma that still persists around loneliness. So Andrew, Diana, what I would love to do is take this opportunity to first start our conversation by reflecting on what we've been through over the last almost year and a half with this pandemic, and to in particular think about how our lives have been infected. And I'd love to just hear from both of you about how this pandemic has impacted your life, the social connection in your life. And then we'd like to understand what you've seen in the country where you're coming from in terms of how the pandemic has impacted people's social connections. Diana, perhaps we can start with you.
With great pleasure. So I think I would have a couple of reflections, I guess, on the last year and a half. So I think pretty much all of us experienced a sense of loss of control over our lives. I certainly did. All the things that I thought I could automatically do, suddenly I couldn't do. And I think it also put into stark relief quite how important it is to all of us as human beings to have that sense of connection to people around us. And I think the flip side of that is that fear of abandonment is a very kind of fundamental human fear. So what I feel about the last year, both personally and, if you like, professionally in my role as Minister for Loneliness, is that there really wasn't anyone in this country who didn't understand quite how important connection is. And even if they didn't feel lonely themselves, and maybe they didn't, there was definitely somebody in their near circle who they were concerned about and were worried that they were lonely. So I think if before the pandemic, those of us who were interested in loneliness sometimes had to convince other people that it was a serious grown-up issue, during the pandemic, I think there's been no problem to convince anybody that this is a serious issue.
That's helpful, Diana. Thank you. And Andrew, how about you? How has this pandemic affected you personally? And then what have you seen in Australia?
Yeah, well, look, I guess firstly I should start by acknowledging that I'm on the lands of Wurundjeri people and pay my respects to elders past, present and emerging. And I'm conscious, speaking to an international audience, that the pandemic hasn't touched Australia in the way that it's touched many other countries in the world. Nonetheless, we've experienced lockdowns, and I'm in one at the moment. And when your life is physically confined, that's a very powerful prompt to think not only about the things that are close to you, but the people who are not. And I think I'd really share Diana's reflection that the shared experience of disconnection in a physical sense has really focused an attention on loneliness as something, I think your words, Diana, were something grown up to talk about, if I'm not paraphrasing too bluntly. But I think that's something that really resonated with me, that as people are separated from their parents, from their children, from their friends, that the license to think and talk about how we feel about the relationships that ground our lives has created a conversation.
Absolutely. I mean, and that's what both of you are saying is very powerful. The notion that it is somehow easier to talk about this now because people have had the shared experience of being separated, isolated at times from family. And I've seen that here in the United States as well, with people who have struggled with loneliness, in many cases experiencing deeper loneliness, but those who had not before, perhaps not as prominently, now recognizing that, wow, this doesn't feel good, and recognizing that they're not alone in feeling that way. And I think there's something very powerful there. I think it's created an opportunity, and the real question is, will we take advantage of that opportunity to have a broader, more honest conversation about the impact of loneliness, and then to perhaps then even take it to the next stage of then talking about how do we address loneliness as a country, as a world. And that I think is very powerful. Here, the other thing I've seen also interestingly is, I've seen that people, there are people, as much as it's true that there are those who've experienced deeper loneliness, there are those who've unexpectedly found greater connection during this pandemic. There are people early on in this pandemic who actually bubbled together with family and with friends, recognizing that a period of isolation may be coming. And they found that even as they were separated from some friends, they grew more close to those in their bubble. And that was an unexpected silver lining of this pandemic. I'll tell you on a personal note, for me, in early March of 2020, when things were beginning to close down here in the United States, we happened to come, my wife and I, and visit my grandmother in Miami, Florida. And we were visiting her because she had fallen and fractured her hip. We wanted to see how she was doing and support my parents and my sister who were caring for her at the time. But we decided actually just almost, in the spur of the moment, just to stay here because everything was closing down. And for the next year, we spent our life in an extended family environment with our two small kids who are now 3 and 4, and with my parents, my sister, my grandmother, and 2 cats. And so it was a full house, if you will, chaotic, confusing, complicated at times, but extraordinarily rewarding in terms of the deeper human connections that we built with our family. And so it's this interesting experience that we've all had, though, in some way, shape, or form, of having our connections being affected. And I'm curious, as you look at the UK and Australia, and we look for bright spots, are there bright spots that you've seen in terms of initiatives or organizations or examples where greater connection has been fostered during this time of the pandemic?
Well, certainly I would say we've seen some definite bright spots. Perhaps the simplest one is what we call in this country mutual aid groups. So spontaneously organized, completely informal people in a street, on a block, just deciding that they're going to watch out for each other. Those who can't get out to do their shopping, somebody else will do it. Somebody will walk their dog for them. All of those sort of everyday acts of kindness. We've seen over 4.5 million people put their hands up and subscribe on their local WhatsApp group to help their neighbours. And I think that's wonderful on many levels, both for the help that it's offered, but also because, as we know, every one of those people will feel they got more out of offering to help than they put in. So I think it is, how do we channel that for the future in a way that is practical?
It's really extraordinary. 4.5 million people signed up. Did I hear you right, Diana? That's really extraordinary. Huh. And can you tell me a little bit more about how that came to be? Was that organized as a central effort, or did the platform...
I'd love to say that it was the wisdom of government, but actually it was a very spontaneous local effort, a kind of self-organizing movement using WhatsApp, Facebook, and other platforms to create local networks. We did initiate in this country a volunteer program called the NHS National Health Service Volunteer Responders. And that involved a range of tasks that you could undertake, from phoning up people who were lonely to running errands, etc. And we had hoped that 250,000 people would sign up, and we had 750,000, and we had to close it because there were so many volunteers. So I think one of the super positive things is when you say, as a community or as a government or as a neighbour, I need help, people were just super keen to be helpful. And I think that speaks volumes of humanity.
That's really inspiring. Wow. And Andrew, how about you? What have you seen?
Yeah, the spontaneous response in community at a similar level. I couldn't quantify it in the way that Diana just had, but I was just thinking the underpass at the train station near me, where a woman and her family inspirational and encouraging messages, particularly targeted at children who, of course, struggle particularly through some of the challenges of the pandemic. And I think we've seen demonstrations of so many organisations within the community turn their networks or their capacities to reaching out to people, particularly when we've seen particular blocks of apartments or communities doing it tough. We've seen faith communities or trade unions come together in demonstrations of solidarity. And I think that's something that, again, I hope we can not see recede when the pandemic hopefully recedes, but something we can reflect on and look to how national governments can actually better capture and better direct in the future.
That's really inspiring to hear. And, here in the United States, we've also seen a similar grassroots outpouring of support, people stepping up to help one another. I will always remember, especially in the early part of this pandemic, how many people stood up to thank healthcare workers for their sacrifices, recognizing that even if they themselves weren't sick with COVID-19, that they depended on and needed our healthcare workers to keep all of us safe, our communities safe. And the signs that were posted in yards and on social media and others, it stood out as just one moment where there was collective appreciation, and that felt good. We've also here seen a number of local grassroots efforts to support kids who have unfortunately had to go without the nutritional and meal supplements that they get from school when schools were actually shut down. We've seen, interestingly, people in some ways see more clearly the struggles of other groups here, particularly parents who have really had a tough time during this pandemic. They've had to do virtual learning for their children while also figuring out how to work from remote as well and balance a whole other set of family responsibilities, almost as if nothing happened, differently. And that's been really tough for a lot of parents. But I think that the challenge of parenting, even pre-pandemic, I think has been and balancing, work in a society that tends to be centered around work instead of people. That struggle, I think, has been brought even more out into light. And I mention that only because if a feature of loneliness is feeling invisible and unseen and feeling like you're not understood, these opportunities to see more clearly the struggles of various groups in society through this pandemic, I think does take us a step forward when it comes to addressing the invisibility that so many people who are struggling with loneliness. So that has been encouraging. And I'd like to, in the last few minutes we have, think about the future. And as we think about what lies ahead, we're obviously still in the middle of this pandemic. We are not through it. We've made tremendous progress in so many ways, and vaccines are making their way around the world, clearly not as fast as we would all like. And I know that, that some countries still don't have the vaccines that they need. I know that Australia is in this category and many other countries. But as we think about the months ahead in this pandemic and even what a post-pandemic life could look like, I'm particularly curious what you think we should be doing to craft that life more proactively. My one worry is that if we do nothing differently, that we are in danger of snapping back to 2019 almost by default, but with the strengths, but also with some of the shortcomings that we faced prior to the pandemic in terms of how we lived our lives and how much social connection we had in our life. So how do you think we should be approaching this conversation about how to design a post-pandemic world that is hopefully less lonely and more connected than the pre-pandemic world was?
Andrew, do you want to go first this time?
Thanks, Diana. I think it's such a profoundly important question. And I guess for me, my starting point would be my view of what the pandemic has done. And for me, it has revealed rather than transformed our society. And I think about loneliness, it's turned a phenomenon that was a crisis in Australia beforehand into something that is recognised as a crisis. It's exposed the reality. It's also exposed to me that no policy question in a modern multicultural society can be dealt with through a one-size-fits-all approach. And we've seen this in the pandemic, I think, in all of our societies, the challenges of recognizing strengths within diverse communities and listening. And I think the same is true when we think about how loneliness affects different groups in society, different by age, by professional background, by ethnic, cultural, faith background, and to get better both at building a database, an evidence base that's more robust, but by working out how we break down not just a broad stigma affecting loneliness, but understanding all the stigmas that prevent people from talking about the connections that they want in their life. For me, that's the really big challenge that hopefully opens the door to probably the question that policymakers need to be really thinking hard about, which is how do we build a better world after the pandemic, and what role can we have as elected officials, as people in government, to build more connected societies where we really value social connection as a fundamental part of being a member of our communities. So that's the hopefully not too Pollyanna-ish view that I take to this challenge, Vivek.
Wonderful. And Diana?
Well, I guess my worry at the moment, which I'm not sure is your exact question, but it's top of mind, is where we talked about a shared experience during the pandemic. I think we're going to have a very uneven experience coming out of the pandemic. So there are people who are kind of like a greyhound in a trap and can't wait to bounce out into quote unquote normality again. But also we know there are people whose lives have been shattered by the pandemic, who've lost loved ones, who've lost employment, whose confidence has been really knocked. So I think we just need to be sensitive to the fact that it's going to be a very uneven emergence and think about that. I guess that's my first thought. My second really is that it can feel overwhelming, loneliness as an issue. And I think on the one hand, it affects so many people. On the other hand, it is something where every single one of us can make a difference. And I think we do try and focus on, you know, what are the things that each one of us as human beings can do? Pick up the phone, write a letter, talk to somebody out of doors, through a window, however that might work. So I think, you know, the smallest possible thing that makes the biggest possible difference is definitely worth considering. So we keep people engaged. And then at a slightly more sort of strategic level, I think one of the areas that I'm particularly interested in is those who experience the most loneliness. What can we do to make them the helper rather than the helped? So can they volunteer? Can we give them a sense of agency? Can we help them build their connections? And part of that, I think, links in with the whole social prescribing movement, which is really getting a lot of investment in this country and expanding. And I know I'm not suggesting we're the only ones to be doing it at all, but I think that thing about saying, what is it that you enjoy? So I remember when I started in this role, someone said to me, your task is to see if you could, you know, we were funding different projects around the country, and someone said to me, you've got to imagine that you'd be able to get your mother through the door. Well, my mother sadly has been in heaven for some time, but if you'd had a thing which said this is a club for lonely people written over the door, she would never have gone through. If you'd said this is an art group, this is a running group, this is a singing group, or what, baking, whatever, she'd have been through like a shot. So I think we also think about what I call a Trojan horse strategy, which is to address loneliness from the perspective of what do you enjoy, rather than you're starting at the loneliness and isolation, without wanting to be naive about people's reality.
Well, this is very powerful actually to hear from both of you, because what I hear both of you saying in your own ways is that we have an opportunity here to really think and act differently when it comes to the post-pandemic life, but that it'll take intention and it'll take effort, and it won't just happen on its own. I think the way you I like the way you put it, Andrew, which I won't say as eloquently, but that the pandemic was revealing, but it was necessarily transformative. That transformative part is yet to be seen, depending on what we do. And one of the things I find myself very grateful for is this growing global effort to address loneliness, this evolving and strengthening coalition, if you will. And I think the notion of being able to elevate the importance of loneliness and social connection on the global stage, the idea of being able to develop strategies, even if they're tailored to each country, but to create a community of learning through which effective strategies can be developed, and then ultimately to resource these efforts so that we can not support research, but also interventions that will help us advance social connection. That, to me, is where we need to go in the future as a world, and that feels exciting. It feels necessary as well. I'll lastly say, just in closing, and I know our time has come to an end here. I could talk to both of you for hours, and there's so much I'd love to pick your brains on. But I do think that one of the great lessons of this pandemic, one of the great reminders, if you will, is that we need each other in profound and small and big ways. And that in our day-to-day lives, whether it's getting through a crisis or whether it's celebrating something wonderful that happens, or whether it's dealing with a disappointment or challenges that inevitably come our way, that we are often better when we have connections with one another. And I think the pandemic has reminded us of that. But it's also, in my mind, reminded us of a fundamental truth as well, which is that we all have the power to be healers. That, as you mentioned, Diana, that when we show up with the spirit of service in each other's lives, we have the power not only to help them, but to heal ourselves. And in that way, I think if we come out of this pandemic with people recognizing a little bit more of the profound power they have to help heal others and themselves, especially through the power of service, I think we will have come a long way. So all of this to say, I think that we have, all of us and many others who are listening today, who have been focused and concerned about loneliness for years, I think that work, that concern, that attention we've given to that issue, I think was so important before, but even more important now. And I hope that we can come out of this pandemic with the urgent recognition that we have to have a conversation about the post-pandemic life, that many people are wondering right now. They're in a state, I think, where they're open to thinking about what really matters in life. What do they want to build their lives around? And I think there are a lot of people who recognize that building their lives around people and relationships are perhaps the greatest path to fulfillment and better health and happiness. Perhaps then building a life entirely centered around work, which is for many of us, myself included, how my life was being built. So that's the work I know we all have to do in the time ahead. That's the leadership that all of those who are listening here today can provide in their families, in their communities and neighborhoods, and in their countries. But I just want to end by thanking both of you, Diane and Andrew, for being here today, for having this conversation with me and sharing that conversation with everyone who's gathering. I had shared with both of you before we began this conversation that I had certainly heard of you, been introduced to Andrew before, and certainly heard wonderful things about Diana, friends. But for both of you, I held a deep admiration for the work that you have done and the leadership you've provided. So thank you for all of that. I loved having this conversation with you, and we'll certainly look forward to more conversations in the months and years ahead.
Wow. Such a wonderful panel. I think quite a lot of inspiration that was shared. I think quite a lot of the objectives and issues we all on a daily basis are addressing have been heard by this panel and been emphasized. So I want to express sincere gratitude on behalf of GILG for your support and efforts, Mr. Giles, Dr. Murthy, Baroness Barron, and Dr. Martin. Your leadership is indeed indispensable during these challenging times. Moving on, our next speakers are my fellow colleagues, Eddie Garcia and Dr. Michelle Lim, who are the co-directors of the Global Initiative on Loneliness and Connection, and will introduce GILG, its role, members, and its work so far in building a global representative organization comprising of loneliness organizations from around the world. Michelle, Eddie, the stage is yours.
Thank you, Yanis, and thank you, Eddie. I'm speaking to you from Melbourne, Australia, which sits on the traditional lands of the Wurundjeri people. So I'd just like to acknowledge their elders past, present, and emerging. So loneliness and social isolation are shared social and health challenges which transcended international borders well before the current public health crisis. But the onset of the coronavirus pandemic has really highlighted to many of us the importance of being connected and having meaningful social connections. So the development of the global initiative in loneliness and connection could not have actually come at a better more critical time. So we've attempted to curb the growing reports of loneliness and increasing rates of social isolation through evidence-based research, policy, and practice. And each of the leading organizations that form the global initiative has really focused on tackling loneliness and social isolation in their own ways, mainly because we have different strengths, expertise, and experiences. But with time, we've really becoming increasingly aware that it's only with active international collaboration that we can really accelerate and augment our learnings, our experiences, and resources. From where I sit, I think that loneliness still needs greater attention. Despite the robust scientific evidence of its detrimental impact on health and well-being, we have yet to see significant attention and action. So the global initiative is really focused on putting forward both loneliness and social isolation as key critical health and social issues that world leaders must now address. Eddie, over to you.
Thanks, Michelle. It's really wonderful to be here and to welcome so many leaders from around the world. As everyone has mentioned, I'm Eddie Garcia. I'm the founder of the USA's Foundation for Social Connection and co-director of the Coalition to End Social Isolation, a founding member of the Global Initiative on Loneliness and Connection. Michelle, as you mentioned, the need for a coordinated and global approach truly has never been greater, nor has there been a better opportunity than right now, as you can see from the leaders that are speaking today. The Global Initiative on Loneliness and Connection will seek to fill the gap across nations in their efforts to address these pressing global issues. By bringing together experts from various backgrounds, we have people from community-based organizations, we have policy leaders, communication specialists, and renowned scientific researchers. We're aiming to help support other nationally focused organizations develop concrete, system-wide approaches to build more socially connected communities. Specifically, GILC will do three things: raise awareness through thought leadership and research dissemination opportunities like this web event today. Secondly, encourage global collaboration and knowledge sharing to improve reach and overall impact within and across national efforts. And third, develop and support the operationalizing of national systemic frameworks and strategies to end loneliness and promote connection. However, none of this is possible without a further coalescing and bringing together of other nationally focused organizations who are now or could be tackling social isolation and loneliness within their borders. Our global collaborative seeks to expand our network and build new change agents, build new aligned collaborations worldwide, and ask you to join us in building a healthy, connected global society. Thank you again for joining us today. One such collaboration comes from our next speaker, Dr. Naoko Yamamoto, who is the Assistant Director General for Universal Health Coverage and Healthier Populations at the World Health Organization. Dr. Yamamoto brings nearly 30 years of experience working on health in Japan and served as the Senior Assistant Minister of Global Health in Japan's Ministry of Health, Labor, and Welfare. We're so honored to have her and our World Health Organization colleagues speak today, and I'll turn it over to her presentation.
Ladies and gentlemen, dear colleagues and friends, good morning, good afternoon, good evening. It is a great pleasure to be here with you. Human beings are fundamentally social animals. High-quality social connections are essential for our mental and physical health and our well-being at all ages. The global COVID-19 pandemic has drastically altered people's lives. Measures taken to slow the virus have also had adverse effects, including reducing both the quality and quantity of social relationships. The United Nations General Assembly declared 2021 to 2030 the decade of healthy aging. This initiative presents a major opportunity for the World Health Organization and other UN agencies, governments, researchers, practitioners, civil society, businesses, and others to work together to foster longer and healthier lives. Integral the priority actions for the decade is to address social isolation and loneliness in a more sustained way. Social isolation and loneliness are growing public health and public policy concerns, which have been made more salient by the COVID-19 pandemic. Several countries, such as the United Kingdom and Japan in particular, have made tackling social isolation and loneliness a political priority to ensure that all people benefit from social connections. Social isolation and loneliness among older people are particularly widespread. For instance, 20 to 34% of older people in China, Europe, Latin America, and the USA are lonely. Rates in institutions are higher still. Social isolation and loneliness are harmful. The serious consequences for the health and longevity of the older people include increasing risks of the physical health conditions such as cardiovascular disease and stroke. The consequences also comprise increasing risks of mental health conditions such as cognitive decline, dementia, depression, anxiety, suicidal ideation, and suicide. All this results in shortened lives. In addition, social isolation and loneliness impose a heavy financial burden on societies. But social isolation and loneliness can be reduced. For instance, through face-to-face or digital interventions such as cognitive behavior therapy, social skills training, befriending, peer support, and social activity groups, and by improving infrastructure in our communities, for example, transport, digital inclusion, built environment, and promoting age-friendly environments. We can reduce social isolation and loneliness through laws and policy to address, for instance, ageism, inequality, and the digital divide. On July 13th, the UN will launch an advocacy brief on social isolation and loneliness that proposes the three-point strategy for these challenges during the UN Decade of Healthy Aging. First, implement and scale up effective interventions to reduce social isolation and loneliness. Second, improve research and strengthen the evidence for effective interventions. And third, create a global coalition to increase the political priority of social isolation and loneliness. In this regard, WHO welcomes the launch of the Global Initiative on Loneliness and Connection, GILC. The knowledge platform built supports the implementation of the decade will link with GILC and host a specific hub on social isolation and loneliness. Through the hub, people can find, share, and co-produce knowledge that can help individuals, communities, and wider society prevent and respond to social isolation and loneliness. As mentioned, COVID-19 and resulting lockdown and physical distancing measures have been stark reminder of the importance of social connections in all our lives. This is a time to act together internationally, regionally, nationally, and locally to ensure that we reduce social isolation and loneliness. The benefits are many and include longer, healthier, and more dignified lives and greater sense of connection to families, friends, and communities. I thank you.
Yamamoto, thank you for expressing your support and the necessity to address social isolation and loneliness globally as a representative of the World Health Organization. We're definitely looking forward to future collaboration. And now it's time to move the spotlight towards you, the participants of today's webinar. And just about a minute, it's time for you to activate your cameras and microphones. We're about to jump into 15 minutes of breakout sessions, allowing you to share your thoughts with the other participants in an interactive setting. We have some questions prepared for you, which are currently displayed on the screen. And at the beginning of the breakouts, they will also be shared via the chat. Also, really lovely, you can entirely focus on the conversations within your group without taking notes, because each group will have a facilitator and scribe. So you can dive in completely and sharing your ideas, questions, thoughts with each other. So the three questions being displayed: what are the global themes in the way countries responded to COVID-19 and loneliness? What should be the global response to loneliness be after COVID-19? And what do you think the role of GILG should be? In regards to the time on our hands, we would like to ask you to specifically focus on the second and on the third question, because we are highly interested in getting your feedback and your thoughts and ideas on those two questions. Enjoy lively conversations and have a good time in the breakouts. Welcome back, everyone. I hope you had a lovely conversation within your breakout rooms. We really hope you enjoyed those small glimpses of community spirit. As I said earlier, today was a quite packed webinar, but we tried our best to keep it interactive, and you tried your best. Also, I saw the chat function earlier nearly explode, so feel free to continue sharing some thoughts and questions. We now have a polling question coming up, which allows you to actually shape the future, because the question is, what would you like to see happen next? And it should be on your screen right now. Once you've answered this question, please use the spare minutes you have on your hand to share one thing you've learned today, or you will do as a result of the presentations you've heard or the discussions you've had today during the breakouts, so that we can pull recommendations, ideas, suggestions from the chat for the write-up and also for our next steps as the global initiative on loneliness and connection. So as you can see, there's a specifically high interest in evidence-based international recommendations developed and delivered. So I think we will definitely take this one with us, but also across the board, we see interest in those different aspects, consistent frameworks co-developed and implemented internationally, or also to develop a global awareness campaign to raise more awareness, reduce stigma around the globe. So plenty of fresh ideas and objectives for us to take with us and to deliver upon. So this is it. We've come to an end, and I guess after all this input, you might need some fresh air and water, reflect on what you've heard today. Thank you to all the people who have shared their knowledge, time, and experience to make this event possible. We have wonderful speakers, and I especially would like to thank my fellow Guild members and the members of the Campaign to End Loneliness who curated and organized today's event. And I want to specifically thank all of you, the participants who all the way have been with us and expressed thoughts, ideas, which help us in the weeks and months to come. Have a wonderful morning, afternoon, or evening, everyone. It's been a pleasure, and see you soon.